1/3 of the adults in the US and Canada are on some type of diet, and another third are at least trying to maintain their weight. We are spending over $30 billion each and every year in the US alone on diets and weight loss programs. So what are we getting for our time, our money, and effort when it comes to diets and weight loss programs? Well, the medical literature is very clear in the fact that even if anyone is able to lose weight on a diet, that 2/3 gain this weight back within just 1 year. And if you go out 2 years, 98% of these individuals gain their weight back and more. In other words, diets fail 98% of the time, or looking at it from the positive side, diets are only successful 2% of the time. I would not say that we are getting much for our effort when it comes to diets. However, people are out there looking for the next fad diet that is coming down the pike and will jump on the bandwagon without any thought of the fact that diets just don't work. Let's look at it another way. If diets did work, you would think that the obesity rate in the US, Canada, and around the world would be dropping dramatically. However, just the opposite is happening. Over 2/3 of the adults and over 1/3 of our children in the US and Canada are now considered to be either overweight or obese. This has doubled and tripled over the past 2 decades in spite of Weight Watchers, the Atkins diet, Jenny Craig diet centers, and the list goes on and on. So you should be asking yourself, why don't diets work? The main reason diets don't work is the fact that they are a short-term solution for a long-term problem. Now, when a patient comes into my office and says, "Dr. Strand, I'm going to be going on such and such a diet." Now, I really don't care which diet they are going on. The connotation is the fact that if they're going to be going on a diet, somewhere in the future they are going to be coming off that diet and usually returning to those poor lifestyles that got them into trouble in the first place. The other reason diets don't work is the fact that they are not healthy. They will cut out most of the fat, or they'll cut out all the carbohydrate in an attempt to achieve weight loss. However, the body needs good fat and good carbohydrates to function properly. You just can't stay on these unhealthy diets for any period of time. But the main reason diets fail is because they do not address the underlying or root cause of the overwhelming majority of cases of obesity, which is insulin resistance. Once you become less sensitive to your own insulin because of poor lifestyles and inactivity, you begin to gain an unusual amount of weight around your middle, and you develop a resistance to weight loss. In other words, you begin holding on to fat like a sponge holds on to water. Now, the only way you can begin to lose this weight effectively is to firmly establish healthy lifestyles that actually improve insulin resistance. This allows you to reverse this underlying insulin resistance and actually begin releasing fat. I have learned that it takes a triad of healthy lifestyles that have been shown in our medical literature to improve insulin sensitivity. This is a healthy diet that combines those good, healthy, low glycemic carbohydrates, those good fats, and good proteins, along with a modest, consistent aerobic exercise program and nutritional supplementation. Each of these lifestyles improves insulin sensitivity from a different mechanism. And when you combine these together, it gives you the best chance of improving insulin sensitivity enough to allow you to actually tip back into a normal metabolic state and establish your healthy weight permanently.